Hello and welcome to Tracking COVID-19. I'm Rukma. In the next half hour, we scan through the developments of this week from across India and the world. The economic devastation caused by coronavirus may be as unprecedented as the human toll. Whether we talk about oil prices going to the negative in the US or the impending food crisis in Africa, clinical trials of the vaccine have begun in the UK. In the show today, we discuss how India, through its preparedness, is leading as an example to reckon with in these testing times. All that and more, let's begin with the top stories. Active coronavirus cases in the country reached 19,868 with 824 fatalities and 5,803 recoveries. Group of ministers reviews current status and action for management of COVID-19 in its 13th meeting. Health Minister Dr. Harshvardhan commends collective efforts of all stakeholders in combating COVID-19. Home Ministry clarifies that latest relaxations in lockdown restrictions pertain only to shops selling items. Those rendering services such as restaurants, salons and barbershops will remain closed. Liquor stores will also remain closed. Inter-Ministerial Central Team writes to West Bengal Chief Secretary, seeks clarity on stand of state government on facilitating visits of IMCT and ensuring safety. Global COVID death toll crosses 2 lakh mark, over 28.9 lakh people infected so far. WHO warns governments against issuing immunity passports or certificates to recovered people, says there is no evidence to prove that COVID patients cannot be reinfected. UK becomes 5th country to record more than 20,000 COVID deaths. Confirmed cases in the country almost touch 1.5 lakh. After battling coronavirus successfully, British Prime Minister Boris Johnson to return to office on Monday. US remains hardest hit by COVID-19. New York governor to authorize independent pharmacists to run diagnostic tests for COVID-19. Spain reports near 3,000 cases on single day. Government to come with de-escalation plan this week. And let's first take stock of the developments in India in Ground Zero. As per latest updates of the Ministry of Health and Family Welfare, the country has 19,868 active cases of COVID-19. 5,803 persons have fully recovered from the illness and have been discharged, while 824 persons have lost their lives. So active cases are 19,868, discharged and recovered 5,803, and number of deaths 824, and total confirmed cases 26,496 in India so far. And now we get you the breakup of the COVID-19 outbreak here in some of the major affected states. Maharashtra continues to remain the worst hit in the total number of infected cases. And this Maharashtra total number of confirmed cases 7,628, active cases 6,229, recovered 1,076, and deceased 323. Maharashtra is followed by Gujarat with a total of 3,071 confirmed cases, active cases 2,656, number of deceased 133 and 282 recovered cases. And next on the list, in third position is Delhi. Confirmed cases 2,625, active cases 1,702, recovered 869 and deceased 54. Next comes Madhya Pradesh. Total number of confirmed COVID-19 cases 2,096, number of active cases 1,787, 210 recovered cases and number of deceased 99. Rajasthan is next on the list. Number of confirmed cases 2,083, 33 are reported dead. Number of active cases 1,557, 493 recovered. Tamil Nadu, confirmed cases 1,821, active cases 838, recovered cases 960 and deceased 23. Uttar Pradesh, 1,793 confirmed cases, active cases 1,505, recovered cases 261 and number of deceased 27. Next is Andhra Pradesh, confirmed cases 1,061. These are the states with over 1,000 confirmed cases, active cases 859, recovered cases 171 and number of deceased 31. Next, after Andhra Pradesh, well, a few other states. So these are the states in which the number of confirmed cases are over 1,000. Well, the 13th meeting of the high-level group of ministers on COVID-19 was held at Nirman Bhavan in New Delhi on Saturday under the chairpersonship of Union Health Minister Dr. Harshvardhan. A detailed presentation of the status of COVID-19 in the country along with the response and management of COVID-19 were made for the group of ministers. Detailed deliberation on the measures taken as of date by the centre and various states and union territories for prevention, containment and management of COVID-19 took place. The GOM was informed that all districts have been asked to follow and further strengthen their contingency plans to combat COVID-19. The GOM was briefed on the state-wise details of dedicated COVID-19 hospitals along with the adequacy of isolation beds and wards, PPEs, N95 masks, drugs, ventilators, oxygen cylinders and so on. The GOM was informed that domestic manufacturers which have been identified earlier have already started production of PPEs and masks, and adequate quantity of the same are available. GOM also reviewed the testing strategy and availability of testing kits across the country along with the strategy for hotspots and cluster management. It was also informed that a national level metadata of health workers, NSS, NYK, NCC, doctors, etc. has been prepared and shared to all states, districts and other officials to mobilize the resources and volunteers or COVID warriors as they are known to all to much needed locations. And in view of queries coming from various sections of society, the Home Ministry today issued a clarification that in rural areas, all shops except those in shopping malls are allowed to open. The revised order implies that in rural areas, all shops except those in shopping malls are allowed to open. In urban areas, all standalone shops, neighborhood shops and shops in residential complexes are allowed to open. Shops in markets and market complexes and shopping malls are not allowed to open. The spokesperson said that all states have to strictly follow the MHA directions.
जो आपदा प्रबंधन अधिनियम के अंतर्गत जो गृह मंत्रालय के आदेश हैं वे सभी राज्य सरकारों के लिए अनिवार्य हैं। राज्य सरकार इन आदेशों को डाइल्यूट नहीं कर सकती, इनमें जो प्रतिबंध लगाए गए हैं उनको डाइल्यूट नहीं कर सकती, पर अपनी स्थानीय ज़रूरतों के अनुसार उनको और स्ट्रिक्ट या सख्ती से पालन कर सकती है। जो शॉप्स आइटम्स बेच रही हैं वो शॉप्स तो खुली रह सकती हैं, लेकिन अगर वो शॉप्स सर्विसेज प्रदान कर रही हैं जैसे हेयर कटिंग या ब्यूटी ट्रीटमेंट या स्पा वगैरह, उनको अभी खोलने की अनुमति नहीं है।
The MHA further clarified that sale by e-commerce companies will continue to be permitted for essential goods only. It is further clarified that sale of liquor and other items continues to be prohibited as specified in the National Directives for COVID-19 Management. As specified in the consolidated revised guidelines, these shops will not be permitted to open in areas, whether rural or urban, which are declared containment zones by respective states and union territories. It would be mandatory for all permitted shops to open only with 50% strength of workers, ensure compulsory wearing of masks and strict adherence to social distancing norms.
ई-कॉमर्स के लिए अभी पुराना ही नियम लागू रहेगा। ई-कॉमर्स के अंतर्गत सिर्फ एसेंशियल आइटम्स यानी कि आवश्यक वस्तुओं की बिक्री की अनुमति है। अभी ई-कॉमर्स के अंतर्गत कोई और सामान का ऐड ऑन नहीं हुआ है।
And as the number of cases soar, Madhya Pradesh has recorded a total of 2,096 coronavirus cases with fatalities rising to 99. However, 210 patients so far have been cured and discharged. These are such 3 patients from different cities of the state telling us about their experience. A woman patient who was discharged after being cured from the disease from Morena district says she received adequate assistance and full care from the hospital staff.
डॉक्टर, स्टाफ पूरा जितनी भी मैडम हैं, कलेक्टर मैडम, सब लोगों ने हमारा बहुत साथ दी, हमारी ज़िंदगी बचाई है। सब डॉक्टर वगैरह पूरा स्टाफ बहुत अच्छा है, सब हमारा बहुत अच्छे से ख्याल रखा। खाने पीने को हमको सब कुछ मिला, सफाई देखभाल पूछताछ सब कुछ हमारा बहुत अच्छे से ख्याल रखा सर। कोई बात की प्रॉब्लम नहीं हुई। घर पे जा रहे हैं सर, बहुत खुशी हो रही है। मेरा ये सब लोगों से कहना है कि इस बीमारी को हल्के में ना लीजिए, ये बहुत खतरनाक बीमारी है। अपना अच्छे से सेफ्टी रखिए, अपने बच्चों को समझाइए, घर में रहिए, सेफ रहिए।
The first positive case in Madhya Pradesh also was discharged from a hospital in Sagar district. He thanked the medical fraternity and urged others to follow due precautions.
अच्छा रहा, पूरे मतलब स्टॉप को अपनी फैमिली बना लिया था। बढ़िया रहे, किसी ने कोई कमी नहीं होनी थी। थैंक यू, दिल से थैंक यू। फैमिली पूरी पीछे खड़ी है, जिसने पूरा सपोर्ट करा सबने साथ दिया। प्लीज़ भाई लापरवाही मत करो, अपनी जान के साथ मत खेलो, दूसरे की जान के साथ मत खेलो। और प्लीज़ मतलब हाथ जोड़ के निवेदन है उन लोगों से जिन लोग को कोई भी बीमारी है और वो लोग चेकअप कराने नहीं आ रहे हैं।
And we now look at some reports that inspire hope and positivity in these difficult times. Local clubs and organizations in Manipur are doing commendable work, providing essential commodities free of cost to selected poor families in a phased manner and in a systematic and unique way, strictly maintaining social distancing for the safety and as a precaution against COVID-19. More in this report.
During the lockdown period, in order to contain the outbreak of coronavirus, in addition to the government efforts to distribute the essential commodities to the poor section of the people in Manipur, local clubs here also doing a great job to extend the possible assistance and possible help towards the needy and the poor section of the people in their respective localities. Now I'm going to meet one David Kumansa, the secretary of this association. Could you tell us how you manage to raise your fund and how you distribute the items to the people?
Yes, firstly, my name is David Kumancha and I am the General Secretary of this club, Lamphel Sanaketel Development Authority. Since the lockdown has been started, in order to reduce the hardship being faced by the poor section here, our club took a decision and distributed essential commodities to the poorest section of people in this place in phase-wise manner. We have already done second phase. Over 170 households have been given essential commodities from our side. And we raise funds from our locality, especially from government employee and well-to-do families. And also we are planning to do the third phase shortly.
This shows that local clubs here are also taking a great role in helping the government in order to reach the essential commodities to the far-flung areas and the needy people here. With cameraman Kelemba and Biswajit Singh, Lamphel Sanakaitel, Imphal, Manipur.
Internationally acclaimed wrestler and Olympian medalist Sushil Kumar, who is an Arjuna awardee with many national and international medals under his belt, saluted India's frontline corona warriors as he walked into the police station at Najafgarh in Dwarka yesterday. He expressed his appreciation for how the female staff of the police station continued to work beyond their duty hours, preparing food and masks, distributing this along with milk and medicine to the needy. And let's now scan through developments from across the globe in World Wrap. The World Health Organization has said that there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second coronavirus infection. In a brief, the agency has warned governments against issuing immunity passports or risk-free certificates to people who have been infected, as their immunity is not guaranteed. The practice could actually increase the risks of spreading the virus, as people who have recovered may ignore advice on taking the necessary precautions. Chile said last week it would begin handing out health passports to people who had developed antibodies to the virus. They could immediately rejoin the workforce, the Chilean government said. Meanwhile, WHO continues to review the evidence on antibody responses to COVID-19. And New York Governor Andrew Cuomo on Saturday said that the state will begin conducting antibody tests for workers at 4 hospitals hit hardest by the pandemic. Antibody testing is a way of determining if a person has been infected by the virus, even if they have not shown symptoms. The state will also allow local pharmacies to begin collecting samples for diagnostic tests. Under a new executive order, Cuomo plans to grant independent pharmacists the authority to conduct diagnostic tests for COVID-19. Collected samples will be tested at labs off-site. This could add an additional 5,000 testing locations in New York State. Meanwhile, in a new tally, the United States recorded 2,494 more coronavirus deaths in the past 24 hours. The country now has an overall death toll of 53,694, with 9,36,293 confirmed infections. And Spain's health authorities say 2,944 new infections were confirmed in the previous 24 hours, taking the total to nearly 2,23,759 in Spain. In this connection, Spanish Prime Minister Pedro Sanchez announced while addressing to the nation that people will be allowed out to exercise from May 2nd if the number of new cases continues to fall. He also said that the government on Tuesday will explain the de-escalation plan after a weekly cabinet meeting. Since Spaniards have been living under one of Europe's strictest lockdown measures, since March 14th, they are allowed out for shopping, for food, medicine and essential work, but not for exercise. The total fatalities in one of the countries most badly affected by the virus rose to 22,902, and the overall number of cases now stand at 2,23,759. And in Italy, police deployed their eyes in the sky to monitor citizens ignoring lockdown measures to contain the coronavirus outbreak. Video shot from helicopters over Milan and Rome showed virtually deserted cities with few people out of doors. Deaths from the COVID-19 epidemic in Italy climbed by 420 on Friday, the smallest daily tally since March 19th, but the number of new infections rose to 3,021. The total fatalities now stand at 26,384, the second highest in the world. And France reported 516 new deaths from novel coronavirus in the past 24 hours, bringing the overall toll to 22,614 fatalities on Saturday. However, the number of patients in intensive care continues a 2-week decline, falling by 165 over 24 hours to 5,053. And Britain became the 5th country to have the highest official coronavirus death toll in the world after the US, Italy, Spain and France. The British government says it is too soon to ease a nationwide lockdown imposed on March 23rd and extended to May 7th. Interior Minister Priti Patel repeated the government's message to the public on Saturday to stay at home. And let's now examine some facts behind information floating around during the outbreak here in India in COVID-19 Fact Check. There is a widely circulating message on WhatsApp that claims that the government had launched a scheme, WCHO, under which people are being given 1,000 rupees each. Further, the message requires people to click on a link and provide their information. Terming it fake news, Fact Check Unit of Press Information Bureau has clarified in a tweet that Government of India is not giving out 1,000 rupees to anybody under the so-called Corona Sahayata Yojana scheme. The tweet has clarified that the claim and the link both are fraudulent and has warned people against clicking on it. And that's all we have time for in this edition of Tracking COVID-19. Namaskar.